Ultimately, we may end up talking to you about doing a hysterectomy in order to control your abnormal bleeding. This is usually our last and most definitive treatment option and is reserved for cases that are either particularly difficult or not responding to other treatments. Hysterectomy is commonly done because ultimately it will make your bleeding end. But if we can control your bleeding with other less invasive or smaller types of procedures, then we like to do that. When deciding whether or not a hysterectomy is right for you, we have to also determine which style hysterectomy may be right for you. There are a lot of things that weigh into that decision, such as your medical history, your surgical history, your anatomy.
I had always had problems with like the abnormal bleeding and menstrual cycles, all that. I've had they would be so beyond painful. I had even passed out quite a few times. I would get sick, and so I was even told long before I had kids that I couldn't have kids because of all the abnormal things going on. And then after I had them, I did start getting a little concerned, and after some more tests and different things, that's instead of getting tubes tied, it ended up being a hysterectomy.
Hysterectomy can be performed in one of the following ways: either through an abdominal incision, through a vaginal hysterectomy, or through a laparoscopic assisted hysterectomy. Let me go over each one of those in order. An abdominal hysterectomy is done through an incision that's made in a patient's abdomen, either transversely or side to side, or vertically, up and down. The decision for which approach is made by the physician and is often not made until the time of surgery itself. It frequently depends on the indication for the procedure and the size of the mass. Abdominal hysterectomies are most often performed either for very large fibroids or for the presence of ovarian or uterine cancer. Vaginal hysterectomies are performed completely through incisions made in the vagina. The benefit of a vaginal hysterectomy is that it can be performed with a short recuperation and with only a one-night hospital stay. Vaginal hysterectomies require the uterus not to be too big, otherwise it would be impossible to get out. The benefit of vaginal surgery is that it is minimally invasive, recovery times are shorter, and oftentimes risks are less. It can also be combined with other procedures, for example, the treatment of stress urinary incontinence. Laparoscopic hysterectomies have become more popular because of the minimally invasive nature of laparoscopic surgery. Laparoscopy uses very small incisions, often less than 1 centimeter or half an inch, that are made in the abdomen. Laparoscope is inserted through these incisions and used to guide the surgery. Advantages include the minimally invasive nature, as well as being able to see better and more close up, so precise surgery and blood loss is minimized. The Da Vinci surgical robot has several advantages when performing laparoscopic hysterectomy. The first is that it uses a double viewing system, which means that we have depth perception as we look through the camera. The second aspect is that the instruments are wristed, which means that we operate in the same way we would if we were doing an open or vaginal procedure, and we're able to more precisely work with the patient's tissues and organs. And finally, the third aspect is that because the incisions are so small, patients generally are able to go home on the same day that they have surgery and recover within 1 to 2 weeks and resume their normal activities. All types of hysterectomies have certain risks and side effects. Let me go over several of the most common. Anytime you have surgery, you're at risk for issues from anesthesia, bleeding, or infection. With all types of these surgeries, these risks are quite uncommon, and in general, surgery in the United States, and in North Suburban especially, is very safe. In addition, anytime you go into a person's abdomen, internal organs may be damaged. During hysterectomy, the most common organs are the bladder and certain types of blood vessels. While we're careful to avoid damage to that, the risk from bladder or excessive bleeding is approximately 1%, or 1 out of every 100 patients. Finally, people often ask, what are the effects afterwards on issues related to hormones and sexual issues? If the ovaries are left in at the time of hysterectomy, there should be no hormonal changes, and people will not necessarily go through menopause at any different time than they otherwise would have. That is to say, again, if the ovaries are left, no menopausal changes occur. Patients often have questions after hysterectomy about whether it will be associated with changes in sexual performance or with long-term weight gain. The data shows that after the initial postoperative period, both sexual pleasure and weight gain are not adversely affected by hysterectomy.